Greetings. I'm Francie Stoner, president and founder of LAUGHH Foundation, and we have an amazing board, very diverse and very talented healthcare professionals. And we're honored to have today our pediatric advisor, Dr. Rosalyn Stewart, who is an associate professor of internal medicine and pediatrics at Johns Hopkins. Roz, thanks.
Thank you, Francie and everybody from LAUGHH. I'm pleased to be here. I wanted to start by demonstrating the proper way to wear a mask. Now that states are opening up, I think you'll be out and about and see more and more people wearing different versions of facial coverings. So this is a simple cloth mask. And the trick with wearing a mask is it needs to cover the nose and the mouth. So you might see a lot of people with their nose poking out. That is not the right way to wear a mask. Covering the nose, covering the mouth. This is what you should wear every time you're out in public. And you should wear a cloth mask. The idea behind masking is that it keeps your secretions from going airborne. We know that coronavirus is an airborne illness, so it gets out in the air and then can go to other people or to other surfaces. So the cloth masks keeps your secretions from going out into the air, but it does not prevent other people's secretions from affecting you. So when you are out in public, even though you're wearing a mask, it is still very important that you maintain that 6 feet of social distancing in order to prevent other people's secretions from landing on you. So with that introduction and a little bit about masking, I am available for any questions you guys have about how do you maintain your safety and what's going on currently taking care of COVID patients.
So Dr. Stewart, this is Francie. Question, it gets real confusing when you're going out, getting in the car, going into the store, coming out of the store, got groceries with me, going into the house. When do I put all this stuff on? When do I use sanitizer? What do I do?
That's a very important question. If you are by yourself in your car, you do not need to wear a mask. You should put your mask on before you leave your car. It is a good idea for you to have hand sanitizer in your car. So you sanitize your hands before you touch your mask, you put your mask on, and then you're ready to leave the car. Many people choose to wear gloves. So if you choose to wear gloves, you put your gloves on, then you put your mask on, and then you leave the car and go to the store. The idea with gloves is the same as using hand sanitizer. It keeps the surfaces of your hands clean. The risk when you're in the store is you're touching things that maybe were touched by other people or were in close contact with other people. And so their secretions might be on those surfaces. Things like the shopping cart handle or the handles to the frozen food section, or even some of the products themselves, other people might have been looking at them closely enough that their secretions got on them. So when you're leaving the store, you want to put all the groceries in your car, and then you can take your gloves off, but use hand sanitizer again before you go touch your steering wheel, and take your mask off. The real rule of thumb is you can't use hand sanitizer too much. So if you get confused, more hand sanitizer is probably better than not enough hand sanitizer.
So Dr. Stewart, I have a question about masks. Do I have to wash them after every time I use them, or can I wear them a couple times and then wash them?
That's an excellent question. Most of the cloth masks are machine washable. So you could wear them a couple of times before you wash them. and then you need to wash them. So it's kind of like the clothing that you wear. If you wear a t-shirt all day, it probably needs to be washed. But if you wear a t-shirt just to go out to go to the grocery store and then come back, it's just a short period of time, and then you let it dry out. So when in between uses, you might want to put it in a paper sack or have it hanging somewhere so it could dry out, and let your respiratory secretions that are kind of moist dry, and then the mask is ready for another use. So if you are like doing something where you're outside all day, then at the end of the day, I'd probably wash the mask.
Thanks.
Okay, Dr. Stewart, I have a quick question about going to the hospital. Is it safe to go to the hospital for other things, other illnesses, other tests unrelated to COVID-19?
That is an excellent question. So I can tell you about Johns Hopkins Hospital, and I think it's working like many other hospitals, is we now have divided entrances to the emergency department. People who have respiratory illness symptoms, the COVID entrance, and then a non-COVID entrance. So if you're sick with a heart attack, let's say, you would go into the non-COVID entrance. If you're sick with the flu or COVID or asthma, you would go into the COVID entrance. All patients are given a mask. Every provider that you see doesn't wear a cloth mask. We wear a surgical mask and a face covering. And the idea behind the face coverings is many of the people who are there for non-COVID-19 reasons could be in that asymptomatic population. And so it helps protect the healthcare workers from getting sick from people who don't know that they have the virus.
Okay. I have another question about if someone gets admitted to the hospital with COVID-19, how do their family members or their loved ones communicate with them or possibly visit them if possible because of for safety reasons?
So the really sad thing about what's happened in the hospital with COVID infections, so let's say, again, you went to the hospital for a non-COVID-19 reason and you needed to be hospitalized. All throughout all hospitals, there are no visitors for adults. So if you're an adult patient and you need to be hospitalized, you cannot have a family member with you. Although there are some exceptions. So let's suppose you're an adult with special needs, like you have intellectual disability or you have dementia. Those individuals get to have one visitor with them to act as their helper. All children who are hospitalized now get to have one visitor also at a time. So these visitors could trade out. So if you are an adult without a disability, then you are unable to have a visitor, but the hospital personnel will call you regularly, and you can always call and talk to your family member in the hospital. The other exception to that is if people unfortunately are on hospice and gravely ill, then we do have compassionate visitation, up to 2 visitors at a time in our hospital.
Okay, thank you.
Dr. Stewart, this is Kay. I have heard, because things are starting to open up now, that people are saying, oh, then I don't need to wear my mask, or it's safe now to go into groups and get together with people that I've missed so much. Is that really true?
That also is a great question. It is absolutely not true. You still now more than ever need to wear a mask. We know that many people that have the COVID-19 illness do not have symptoms, and wearing a mask is very important to keep your secretions to yourself so you're not putting other people at risk if you are unfortunately an asymptomatic carrier. And staying 6 feet away will help protect you from other people who you might not know if they are sick or not. Very important to continue to practice social distancing while you are going out in public. And if you're going to a place that really doesn't seem like they're practicing social distancing, I would advise you not to go there. Go to a different place. You want to go to a restaurant and people seemed all packed in together. Don't go to that restaurant. Go someplace else.
Thank you.
This has been great. Dr. Stewart, we so appreciate the time that you've taken today. I know there are a ton more questions. I think we'll have another discussion and have a broader topic if that works for you.
Yes, of course. Happy to, anytime. Thank you very much.
You bet. Thank you.